As somebody who grew up with asthma since I was 5 years old, found the hard way that I was uninsurable, and that they would be willing to cover just about everything except for my asthma medications. Having walked the walk of having lived a life where I had to split pills and had to cut my doses to just try and survive, I know what it's like, and it's ridiculous. It's ridiculous in a country where we're spending more on healthcare than every other country, but it's still the number one cause of individual bankruptcy. So yes, we need to have Medicare for all. It is a right. It's not a product. Healthcare is not a product. And so we need to be doing what we can to make sure that everybody is fundamentally covered. And I think right now we don't have that. We made as many gains as we could years ago, but there's so much more that we can do. It shouldn't be a question that when you have a symptom that you have to wonder if your healthcare is actually going to cover you or not, or you're going to go broke trying to stay alive, or that when you're a loved one or a child comes down with something, that you're skipping going to the doctor because you have a ridiculous copay to be able to have coverage. That is ridiculous. It is preventable, and we can absolutely do that. And I would add, as much as there might be some differences between us here on the Democratic side of what we want to do, it's worth remembering that on the other side, we had Ron Johnson, who put all of his energy in trying to destroy the gains that we made in the ACA, including filing an individual lawsuit on his own. So that's what we're up against, is those who want to take us backwards. So I want to move us forward as much as we can in making sure this is a right, and nobody goes broke and nobody goes sick, and we actually have a healthcare system when you need it.